We spend 9 whole months preparing for a baby's arrival. We're busy painting the nursery, researching the absolute safest car seats, stockpiling diapers like there's no tomorrow. But why does almost no one talk about what actually happens to a mother's body, her pelvic health, and her intimacy after the baby arrives? There's this giant unspoken expectation that you're just supposed to bounce back. But for millions of women, that silence is actually covering up a ton of unnecessary physical pain and emotional confusion. So, if you're sitting there feeling like your body just isn't working the way it used to, you really need to hear this. Up to 62% of women experience painful sex 3 months postpartum. You are not broken, and you are absolutely for sure not alone in this. But listen, just because it's incredibly common doesn't mean it should be your new normal. It just means we desperately need to talk about it and figure out what's actually going on biologically. Welcome to The Explainer. Today, our mission is to completely demystify pelvic health and intimacy throughout the entire perinatal journey. We're going to break down exactly what happens to your body during pregnancy, during delivery, and in that crazy postpartum period, relying on hard clinical data and expert physical therapy insights. We are leaving all the shame at the door today and replacing it with pure, actionable knowledge. Here is our roadmap for today's explainer. Number 1, intimacy during pregnancy. Number 2, understanding birth injuries. Number 3, postpartum hormonal shifts. And number 4, reclaiming postpartum intimacy. Let's get started. Okay, let's dive into this with Section 1, intimacy during pregnancy. Because long before postpartum recovery even begins, your body is already going through some massive structural and emotional shifts. So, libido during pregnancy, yeah, it's definitely not a straight line. It is wildly unpredictable, and it's completely driven by biology. In the first trimester, you've got intense fatigue, breast tenderness, and nausea that can just totally tank your desire. Then, in the second trimester, a lot of people actually get a surge in energy. The increased blood flow to the pelvis can honestly heighten arousal. But by the third trimester, the physical discomfort, back pain, and just your changing shape might drop your interest right back down. There is absolutely no correct level of desire here. It's a total roller coaster. Now, in most uncomplicated pregnancies, having sex is completely safe. But there are a few specific medical red flags where you absolutely must pause and talk to your doctor. If you've been diagnosed with placenta previa, which is where the placenta is covering the cervix, if you have unexplained bleeding, if you're leaking fluid, or if you have a history of preterm labor, you need to put sexual activity on hold. Always listen to your body and your OBGYN. Which brings us to a huge one. This is one of the most common yet deeply unspoken fears that so many couples share, and it causes so much unnecessary anxiety. Will sex cause a miscarriage? In most healthy pregnancies, the answer is a resounding no. Your baby is incredibly well protected in there by the amniotic sac, really strong uterine muscles, and a mucus plug that completely seals the cervix. Sex is not going to poke or harm the baby. Miscarriages are overwhelmingly due to chromosomal abnormalities, not physical intimacy. All right, moving right along to Section 2, understanding birth injuries. We're at the pivotal moment, childbirth. And while trauma to the pelvic floor is super common, suffering in silence afterward, not something we should ever normalize. Just to make sure we're on the same page medically, let's talk anatomy. The perineum is the specific area between the vaginal opening and the anus. During a vaginal delivery, as all those tissues stretch out to accommodate the baby, this area can experience lacerations, or what we usually just call tears. But not all tears are created equal, right? First and second degree tears are very common, and they're mostly just limited to the vaginal tissues. But third and fourth degree tears, those are a lot more severe. They can actually cause damage to the tissues and the muscles of both your vagina and your anus. Those require immediate stitching in the delivery room and highly specialized care afterward to prevent long-term pain or even things like anal incontinence. This is exactly why every single woman who delivers a baby deserves pelvic floor physical therapy to get that muscle function back on track, no matter how severe the tear was. And for all the C-section mamas out there, please listen to this. There is this huge misconception that if you bypass a vaginal delivery, you somehow bypass pelvic floor dysfunction. That is completely 100% false. Your pelvic floor still carried the weight of a growing baby for 9 months. Plus, during a C-section, your body goes through a major abdominal surgery that literally cuts through 7 different layers of tissue. Your pelvic floor muscles will often tighten up as a protective trauma response to that surgery in the scar tissue. And that tightness, that directly creates painful sensations during intimacy later on. Let's move to and see how this builds in Section 3, the postpartum crash. Because the physical healing, that's really only half the story. The other half is this invisible chemical roller coaster. Literally within hours of delivering the placenta, your body goes through one of the most dramatic hormonal shifts a human being can possibly experience. The hormones that were keeping your pregnancy going, estrogen and progesterone, they drop off a cliff. But at the exact same time, hormones like prolactin, which makes your milk, and oxytocin, the bonding hormone, they rapidly shoot up. This extreme hormonal crash and reshuffle is exactly what drives so many of the physical realities you feel in those early weeks. You know that sharp drop in estrogen we just talked about? It is directly responsible for night sweats, hair loss, and severe vaginal dryness. And that spike in prolactin, it suppresses ovulation and can literally flatline your libido. So if you're sitting there feeling totally off balance, exhausted, and completely uninterested in intimacy, please hear me. This is entirely biologically driven. It is absolutely not a failing on your part. Emotionally, this hormonal shift is profound. Up to 80% of mothers get the baby blues, which means brief mood swings, tearfulness, and anxiety in those first 2 weeks. But we have to draw a very clear, medically necessary line here. If those symptoms persist, if they get worse, or if you're having feelings of hopelessness or struggling to bond with your baby, that is postpartum depression. It affects 1 in 7 mothers, and it requires and absolutely deserves professional medical support, therapy, and sometimes medication. All right, section 4, reclaiming postpartum intimacy. We understand the physical trauma. We get the hormonal crash. Now, let's talk about healing and some actual concrete solutions. I have to say, this statistic is so incredibly frustrating. 85% of women never discuss postpartum sexual pain with their doctor. They just suffer in silence, thinking it's just their new normal. Or even worse, when they do finally bring it up, they're often completely brushed off and told to just drink a glass of wine to relax. No way. You deserve so much better than relying on alcohol to just endure intimacy. Actual physical pain during sex is your body's alarm bell signaling that something needs real medical attention. So, first things first, we have to throw out the timeline. We treat the traditional 6-week postpartum checkup like this magical finish line where you're suddenly cleared for everything. It's not. It's barely a starting line. Even the experts recommend multiple checkups. Your uterus is still shrinking, your tissues are still trying to heal, and emotionally, you might be nowhere close to ready. Waiting 12 weeks, or honestly months longer than that to have sex again, is incredibly normal and healthy. And this brilliantly illustrates why those physical changes last so much longer than society tells us, especially if you're nursing. At 6 months postpartum, 31.5% of breastfeeding moms report pain during sex. Compare that to just 12.7% of non-breastfeeding moms. Why the huge gap? Because lactation keeps estrogen levels super low, and that directly leads to thinning vaginal tissue and really severe dryness. So what's the actual game plan? Here are 5 highly effective medical steps to reduce the pain. Step 1, open up to your partner to take the pressure off. Step 2, prep with a pelvic wand. It's a tool that gently releases muscle tension and scar tissue trigger points at your own pace. Step 3, get a really high-quality, clean lubricant to fight that hormonal dryness. Step 4, try and own it. It's a set of soft, wearable rings that help you control the depth of penetration. And Step 5, pelvic floor physical therapy. You've got to learn how to properly relax those tight, guarding muscles through targeted exercises. Oh, and while we're on the subject of the pelvic floor, we absolutely have to mention this. Leaking pee when you sneeze or laugh? It's always joked about on social media as this mom rite of passage. Sure, it might be common after birth, but it is not normal. A healthy bladder goes about 8 times a day and 0 times at night. If you're constantly rushing to the bathroom or leaking, your pelvic floor needs rehab. It can be fixed, and you absolutely do not have to live with it forever. You know, we spend so many months preparing for a baby. We design the nursery, we read all the parenting books, but what if the absolute most important recovery plan you can make is for yourself? You don't just have to accept the pain, the leaking, or losing your intimacy as some kind of permanent toll of motherhood. Advocate for your body, seek out the therapy you deserve, and really ask yourself, isn't it time we finally stop suffering in silence?